Does breast implant illness lead to weight gain? Commonly, I see patients who've felt either a gradual increase in their weight or there's been some event that has tipped them into a state where they've just rapidly put on weight. And so as we try to examine this, once again, the way I consider breast implant illness, I consider it as a constellation, obviously, of symptoms that are akin to chronic inflammation. So the implant is one component of this, but it's chronic inflammation. So how does that then lead to weight gain? So now instead of having acute swelling, because these signals are never turned off, we get chronic swelling. And a lot of times I see it in the gut. So look, think of below the breast area, top of abdomen down to mid thigh, that truncal area. I see a lot of people gain a lot of weight. But let's just say if we feel like the chronic inflammatory process is responsible for a lot of this weight gain, which is really fluid. So think about the gut. We have leaky gut, malabsorption, constipation, inability to eliminate our toxins, and we swell more and more and more. There's a large amount of lymphatic tissue associated around the gut. And so you get more and more swelling, you retain more and more fluid, you put on more and more weight. The Skinny Confidential with at Lauren Bostic will explain how she, in her stories, she'll go over how she lost so much weight after her explant. And she, like many of my other patients, was reducing their inflammation. They were trying to do everything right. And then the explant was the missing piece of the puzzle, if you will, that helped them resolve that and their body could reset. So that weight gain, that fluid weight can just get resolved as you decrease the drivers of inflammation, identify the biggest ones, including implants, and remove them from the system. So yes, breast implant illness can be responsible for weight gain if you follow that way of thinking about it.